Sarah Ferguson has been diagnosed with a malignant melanoma, and we send her our best wishes for a speedy recovery. This is a type of skin cancer that originates in the melanocytes, which produce pigment. And some of the risk factors for developing malignant melanoma include lots and lots of freckles, Celtic skin which is pale and doesn't tan and burns easily, blue or green pale eyes, and red or blonde hair. Also, having a family history of malignant melanoma is important, as is lots of sunburn as a child and also sunbed use. Like any cancer, the earlier you diagnose it, the better. Generally, the first treatment is surgical removal and checking to see if any of the local lymph nodes nearby have been affected. And there are various treatment options, including radiation therapy, chemotherapy, or immunosuppressant medicines. And the treatment has got better over time, but still in Ireland there are about 1,100 new cases of malignant melanoma every year, and they really can be very worrisome and difficult to treat. We use a system called ABCDE to help diagnose moles. And just a reminder that if you're in any doubt about any skin lesions or any scabby spots or anything unusual that doesn't heal, please go and see your doctor and get it checked out. And that particularly applies to men as well, who often are a bit reluctant to seek healthcare advice. The ABCDE, the A stands for asymmetry. So if you look at the mole, is it even or does it look different on the different sides? And if you drew it out on a piece of paper, would you be able to fold it and it would look even on both sides? So asymmetry is important. Also, B is for border, and that's the edge. Does it look raggedy? Is it like a map of an island? If you think of a map of Ireland, has it got all these little inlets and different areas? So a smooth border tends to be generally more benign, and then a raggedy border tends to have a higher risk. C is for colour. Benign moles tend to be one even colour, and they're often sort of coffee coloured or light brown in colour. But if you see a mole and it's got several different colours, and there may be some dark tan, there may be dark brown, there can be black, there can be little areas of red or little areas of paleness called pallor, then the risks tend to go up. D is for diameter. And we would generally say if you think of about 6 millimeters, and that would be the end of, say, a regular eye pencil or an office pencil. Anything over that has more chance of being suspicious. E is for evolving, and that's really important, because sometimes you'll start with a small mole and you notice over time, that seems to be getting bigger. So even if it starts smaller than 6 millimeters, if it's evolving or changing or getting bigger, or it becomes itchy or it bleeds or anything unusual, please do get it checked. The other little tip we use is called the ugly duckling. And that's where you've got a whole group of ducks and just one of them doesn't look right, and we would call that the ugly duckling. So if you have maybe a dozen moles and they all look very similar, but one just looks a little bit out of place, we call that an ugly duckling. Or, I'm showing my age here now, back in the late 60s, if I think of Sesame Street, there was a great song, one of these things is not like the other, and then you had to pick which things. There was like 3 apples and 1 orange, and you had to pick the odd one out. So anything that looks different, please do get it checked out. We also talked recently about sunbed use, and again in Ireland, under 18, it's banned to allow an under 18-year-old to hire or use a sunbed, and it's the same in the UK. And we know that young skin is more vulnerable. The other thing with melanoma is be very careful if you cover most of your body most of the year and then you go away for a 1 or 2 week holiday somewhere very warm and you blast your skin, because that type of exposure is really risky. So try and use your SPF year round on any exposed areas. So in winter, I would still use it on my face, neck and hands. And then for the rest of the year, if I was wearing a t-shirt or a skirt, I'm going to cover any exposed areas at all. And if I do go somewhere warm, I tend to sit under a sunshade. I'll wear sunglasses, a sun hat. I like a little bit of sun, but just nothing where I'm going to burn. And many of us have had sunburns as a kid. It's not pleasant, and also it's risky. So if you're in any doubt, please go and see your medical provider and they can give you more advice. Take care. Bye.